Vulnerable Mothers and Children by Leslie Cantorna. This is a parent support program developed to improve the lives of vulnerable adolescent mothers and their children to offer promising opportunities with parenting, school, employment, and childcare. This type of program serves both generations by providing social support, a source of accomplishment for the mothers, childcare, parenting skills, high school dropout prevention, and mentoring young mothers to stay organized about their own health and needs as well as their child's. Most teen moms live in low-income housing, and most have no transportation, which is one of the reasons why most do not seek medical care. This program will provide transportation to those who may require transportation. Transportation such as to and from school, or to and from work, or even medical care transport. Childcare school-based is a service included in the program that is based on-site of the Young Parents High School, which allows high school-based parenting support and service delivery for the young parents. This child care will deliver high-quality infant and early childhood, which has been known to have a long-term effect on the development and the behavior of the child. It also offers the young parents additional support and daily contact to stay engaged and connected. The model for teens focuses primarily on the young mother's personal resources such as self-efficiency, self-esteem, level of depression, and environmental sources of stress and support. Supportive teen parenting programs in high school will offer young mothers valuable services to help them become more confident as a parent. This will give them the support, the parenting skills, and the type of nutrition that the babies should be eating. Vulnerable mothers face a lot of stress, whether it may be financially, physically, and emotionally. Mental health services can benefit the mother, and maybe the child as well. This applies to individual counseling, family counseling, behavior evaluation, and even emotional support. Developing goals will set a standard view on what the teen chooses for a career path. Coaching and train the teen in what the interview process expectations are, mentor the teen on writing resumes, and assisting in job search, such as what to look for and how to apply. Between the ages 15 to 18 years old, 80% teen girls will become pregnant, and 100% will rely on their poor parents. In 2009, the Federal Interagency Forum stated that there were about 19.6 births per 1,000 girls, and in 2010 there were about 17.3 births per 1,000 girls. Just a slight drop within a year. The impact of this continuum of care will have within the population would consist of prevention of poverty, prevention of illness, lower mortality rates, prevent high school dropouts, prevent depression, and become self-supportive. The methods used within the program regarding social and cultural differences would consist of building awareness of culture and culture differences, develop knowledge of the relative strengths and weaknesses, and to build skill identifying the impact of different cultural settings. The vulnerable mother and child will be pre-qualified for Medi-Cal, CalWORKs, or Healthy Families, which will be low or no out-of-pocket costs, as well as having smaller networks of doctors who are willing to treat the vulnerable population. These two community organizations are a great asset to our program. WIC is based on a health and nutrition standpoint, in which would be a great benefit to our clients. They also offer food vouchers, which are used to promote a healthy diet. In order to receive those vouchers, the vulnerable mother must present their child to the center to obtain measurements and to obtain nutrition education. Friends of the Needy is also another program that is similar to our program. However, they are located in another state. However, I think it would be beneficial if I partnered up with them to gain additional support and resources. The purpose of funding sources is to develop a detailed plan that will determine the project's hours of operations, identify activities and action steps, transforms the recommendation into actionable tasks to be accomplished, identifies action to be implemented, and to identify the need of any legislative actions. One of the potential funding sources is the California Department of Public Health, and their expectations is to identify the action steps for implementing a program, identify the action steps for implementing continuous quality improvement, and to incorporate a program effectiveness as measured by performance standards and outcomes. In order to receive funding by the Los Angeles Department of Children and Family, we must first meet these credentials and develop goals that we must focus on. Practice a uniform service delivery that will provide child safety, permanency, access to effective and caring services, and to have goals such as emphasize children-centered practice, pursue workforce excellence, and to strengthen organizational operations. Pathways assist you with free or reduced cost childcare and administers several programs to assist low-income families with full or partial payment towards childcare while parents are at work, look for work, attend school, attend training programs, or meet other defined criteria. In order to receive sponsorship from Pathways, we must be able to utilize their service and offer the opportunities to the teen mothers by home visitation interviews, provide an overview plan and what the expectations are. Providence Health Services is a big healthcare organization in the West Coast and is rated one of the top performing hospitals in the South Bay. The factors that must be met in order to receive funding is to develop and provide a plan, such as a blueprint showing them where their money or what their money will go towards. Execute the organization is implementing an expense tracker, managing people and resources, monitoring the progress and the performance, provide statistical data by analyzing any improvements that might have been taken place. In conclusion, this type of preventative program will benefit young mothers and their children for a more successful outcome and provide more of any promising future to their children. It may also prevent child abuse, depressions, and lower child mortality rates. Thank you for listening.